But let's start with the biggest of them all, Measure 110. How do you feel about that law? We have new polling that reflects frustration. And while that may not be very surprising, it's still our big story tonight. We get emails and voicemails about Measure 110 almost every day. The vast majority question why on earth the measure has not been repealed yet. Although we still do hear from a few folks who say it has not had time, it needs more time to show its benefits. Now, there's a poll from a well-respected Emerson College, and it shines a light on how many Oregonians feel about decriminalizing user amounts of hard drugs. Before we get into some of the results, let's talk sample size so we know what we're dealing with. 1,000 Oregonians were surveyed over the course of 2 days earlier this month. Emerson used phone calls, emails, and an online panel. The margin of error was plus or minus 3%. Okay, those are the details. Now that we know what we're talking about, let's look at the results. The first question of the survey is perhaps the most important. People got two options: repeal 110 completely or leave it as is. 56% of Oregonians say enough is enough, get rid of it already. And when we dig deeper, the numbers get a bit more lopsided. When asked if parts of 110 should be repealed to bring back penalties for possession of small amounts of hard drugs or leave 110 as it is, 64% say consequences for hard drugs need to return. Now, there are a number of other questions included in the poll, but let's highlight two more regarding homelessness and safety. First, on homelessness, 54% of people polled think that Measure 110 has increased homelessness in their communities. 38% say it has no impact. 8% say 110 has actually decreased homelessness. All right, how about safety? Half the voters polled say 110 makes the community less safe. 30% say there's been no change, and 20% say it actually makes it a little bit safer. It's worth noting that overall Measure 110 draws its strongest support from voters in Oregon's 1st Congressional District, which covers much of Portland. 110's strongest opposition, well, that lies in the state's 2nd Congressional District, which covers most of eastern Oregon. As our team was poring over the results of the survey, we started wondering who paid for this. Turns out it's a group called the Foundation for Drug Policy Solutions. They work to educate lawmakers and the public to try and prevent drug use, treat addiction, and work towards recovery. The foundation's president and CEO is a man named Kevin Sabet, and he's no stranger to drug policy. He's worked in the field for over 25 years and even worked as a White House drug policy advisor, most recently with former President Obama. We caught up with him this week and asked a simple question: why commission a poll like this? And a quick note, we did our interview over Zoom and his camera may be a little bit shaky at times.
There's widespread dissatisfaction with the way that the dollars have been doled out, with the amount of treatment that's available, and really with the lack of accountability. So we decided, why don't we commission a poll with one of the top New York Times rated pollsters in the country and see, what an unbiased poll of 1,000 people, which in Oregon is quite large for a sample. And let's see what happens. And our poll actually really confirmed what our anecdotal research has shown, which is that Measure 110 in people's minds is a failure, that the legalization of drugs is really an unmitigated public health and public safety disaster, because we've legalized drugs before. They were called OxyContin, prescription opioids, alcohol, and tobacco. And if you took those three classes of drugs and put them together, they've caused more damage than fentanyl has ever caused, than illegal heroin has ever caused, than even illegal methamphetamine has ever caused. And that's because when you legalize a drug, the price plummets, commercialization increases, access and availability increases, and therefore addiction increases. And so, we don't have a great track record in our country. The train's left the station on alcohol and tobacco, although with tobacco, we're seeing, huge, obviously, restrictions. I mean, you can't smoke in public anymore, let alone in private. I mean, it's very, very, we have really pushed back against cigarettes. But I'm not saying, we're going to prohibit alcohol anytime soon, but we do know that the legalization of opioids caused huge problems. That's the whole issue with Purdue Pharma and the pill mills and the pain medication overprescribing. I think our experience is that legalization is not good for our country. And I think, what we're seeing even with Measure 110 is this sort of, legalization light, which is really what it is, hasn't been good either. And most people agree with that.
Now, this poll could certainly be used as ammunition for people against Measure 110 if a repeal effort comes along. We asked Sabet about the future of drug policy. As someone who's worked with presidents before, we figure his outlook maybe is going to hold some weight. He claims the way things have happened in Oregon when it comes to drugs has all been part of a lengthy plan.
Well, we know the playbook. The playbook was to legalize medical marijuana, then legalize non-medical marijuana, then legalize psychedelics, which Oregon has done, then decriminalize drugs like heroin and fentanyl, and then legalize those drugs. So this is like Oregon is a perfect case example. Remember, Oregon was the first state to decriminalize marijuana, not legalize, but in the 1970s. So, the activists, that's not like a coincidence that Oregon was also the first state to decriminalize all drugs. This is part of a very well thought out multi-decade plan by those who want to legalize drugs and the billionaires that are behind it, and the billionaires from both sides of the aisle. You have the libertarians on the far right, and you have far left as well. And so, I do think that if Oregon repeals or replaces Measure 110 or continues to have the buyer's remorse, which is certainly where the momentum is, this could stop the legalization movement in its tracks, because this really puts a dent into those plans of the legalization advocates.
So what do you think about all that? How do you think drug policy will evolve in the coming years? Let us know how you feel about Measure 110, will you? Do you think the Emerson poll was accurate or not? Lots of questions in there. Pick one or answer them all. Email us. The address is thestory@kgw.com, or call and leave a voicemail, 503-226-5090.